Guys, we're in the middle of a pandemic and these are trying times. It's hard on our mental health, our mental state. And this is why I love our sponsor today, BetterHelp. They're the largest online counseling platform worldwide. They change the way people get help with facing life's challenges by providing convenient, discreet, affordable access to licensed therapists. BetterHelp makes professional counseling available anytime, anywhere, through a computer, tablet, or smartphone. It's brilliant. Sign up today. Go to betterhelp.com/solvinghealthcare and get 10% off sign-up fees.
COVID has affected us all, and with all the negativity surrounding it, it's often hard to find the positive. One of the blessings it has given us is the opportunity to build an avenue for creating change, starting right here in our community. Discussing topics that affect us most, such as racism in healthcare, maintaining a positive mindset, creating change, the importance of advocacy, and the many lessons we have all learned from COVID. If you or your organization are interested in speaking engagements, send a message to quadcast99@gmail.com, reach out on Facebook at Quadcast, or online at drkwadwo.ca.
Welcome to Solving Healthcare. I'm Kwadwo Kyeremanteng. I'm an ICU and palliative care physician here in Ottawa and the founder of Resource Optimization Network. We are on a mission to transform healthcare in Canada. I'm going to talk with physicians, nurses, administrators, patients and their families because inefficiencies, overwork, and overcrowding affects us all. I believe it's time for a better healthcare system that's more cost-effective, dignified, and just for everyone involved. Quadcast Nation, Solving Wellness Community. We brought back the one, the only, the gem, Michelle Sorensen. Welcome back.
Thanks for having me. It's always good to be here.
It's absolutely great to see you. It feels like it's been forever. Like I probably haven't physically seen you actually since the pandemic started, really.
It's been, yes, since you moved away from the neighborhood.
Oh, we do miss y'all.
Yes, you too.
So we're talking about social anxiety today. And the reason I think this is an important issue is we're in the midst of the relaxation of some of these restrictions. Mm-hmm. And for a lot of people out there, like not only on social media, but people, friends, colleagues, they're struggling with the idea of moving forward. And, I think once again, if we could come from a place of compassion, we could walk through this together. But I think this is a concern to many. So, maybe my first question, Michelle, is is this what you're seeing as well, either professionally or just you being Michelle?
Yeah, definitely just me being a person out in the world like everyone else. I mean, it can be a bit of a cause for division in families right now or in friend groups that some people are at the very anxious end of the continuum, experiencing social anxiety, having a hard time accepting invitations, even to gather in a backyard. And what I find really interesting, and I know you and I spoke about it a bit when we talked about doing this topic for kind of our CBT series, is that a lot of people are even surprised, saying to their therapist or whoever, last summer I was okay doing some of these things. And how come now the idea of going on a patio feels actually scary or wrong? And we have had now 16 months of conditioning and definitely a full year since last summer when things did feel a bit more normal for a lot of people. And then just with all the traumatic events of more lockdown and school closures and healthcare being so overwhelmed, it's understandable that for some people, it's really hard now to think in a balanced way or to figure out what's right for them. And then in terms of what we're seeing in therapy, we see all that, but we also see some of the positives, which is there are a number of people who have welcomed the change in restrictions and kind of the new stages of reopening. And they're really embracing it. And they really notice that when they do some new things, they feel better. They don't need to be in therapy as much, like it feels like recovery for them. Mm-hmm. So as you said, it's kind of nice ideally that we can have compassion for people being in different places and help each other without judgment or pressure, right?
Yeah, no, I love that, Michelle, because I mean, just at a personal level, I must say, just so everyone's cognizant of my bias, I am been very welcoming of the loosening of restrictions and just with our current situation, especially in Ottawa, and you see on the, once again, social media, like, how can we go to gyms again? I'm like, yes, this is what we need. This is good for your well-being, mentally and physically.
Me too. I was at my Pilates studio Friday, the first day it opened, second class of the day, and they laughed and they knew I would be back quickly. And I don't judge anyone who doesn't feel safe. But I think, what you were alluding there to is, like, you see a lot of evidence firsthand, frontline, that tells you, according to your perception, that things are quite safe out in the community, right? And everyone has different levels of risk aversion.
Totally. And so, I mean, I guess we touched on why this is happening, which, once again, completely makes sense. Like, what do people do about it? Like, what are kind of like the principles to kind of get us, those that are struggling with the social anxiety, through these times?
That's right. We always, on this show, we don't want to just talk about the way things are, but like, how can we make it better? How can we make change? So, I mean, from a cognitive behavioral therapy perspective, we always start like understanding the problems. Okay, everything happens within the context of our environment. We're in this, COVID situation, pandemic, perhaps becoming endemic, but like the whole world has been turned upside down. Some people's lives affected in different ways than others, obviously. So we have to look at the environment and start from a place of self-compassion, like, wow, life has really changed. This is a lot to adapt to. And now to try and adapt to a new normal, hopefully, that is a lot. And then we look at, within the context of our environment, what are our thoughts? How does that affect our moods, our behaviors, and then physical reactions? So when we look at social anxiety, I think there's these two main principles. One, like all anxiety, we want to avoid anxiety. Like, that is the human instinct. It feels uncomfortable. Anxiety is a really awful feeling. So whether it's about public speaking, some people don't like using washrooms outside their own home. Like, there's all kinds of people are anxious about snakes, about spiders. People will do anything to avoid what they're anxious about, including social interactions. But avoidance is the evil twin of anxiety. That's how I often say it to clients. The more we avoid, the more we are sending ourselves a message that we're not capable of. And then the more we avoid. And it's just an endless cycle. So, for example, if you think about high school students this year who maybe were anxious about public speaking or exam writing. I mean, who's not anxious going into exams, right? Unless you don't care at all about your grades and about passing. Like, it's a very anxiety-producing experience. But when you have to do it, you get better at it. And then if you go to college or university and the experience is a bit bigger, or the exams are worth more marks, you've habituated, you've taught yourself that you're capable. And that maybe once you're writing the exam, your anxiety drops. Like the way you feel standing outside the auditorium. Do you remember that from university?
Oh my God. Yeah, absolutely.
Like sickening, right?
Yeah.
The days you'd have two big exams, like one at 9 o'clock, one at 1 o'clock. Like, I mean, I look back and I think, wow, like so young and just what you have, but huge formative experiences in terms of teaching yourself that you're capable. So when we look at, again, this is not necessarily a social anxiety example, but when we look at how much avoidance people have either had to or been able to engage in, there are many things that will feel even scarier. And social interactions, whether it's small talk or being with a group of people in a gym, like things that didn't feel anxiety provoking or felt manageable, just like a little nervous, might feel much more now. So this one principle is we want to reduce avoidance. And then the flip side is we want to increase exposure. And in therapy and in CBT, we look at doing gradual exposure in a really thoughtful way. And so for people who aren't necessarily who are listening, who maybe don't have this themselves, but they have a partner or a teenager or a child or a coworker, or they're a healthcare professional and they have, maybe you're a physio or a chiropractor and people on the table are talking about this and kind of opening up. We can kind of plant the seeds, like just start small, right? So in therapy, we might actually do like what we call a a fear ladder where the bottom rungs of the ladder are like the first steps, the more manageable, the least anxiety producing. And then we build our way up. But even just in casual conversations with compassion, we might be able to plant seeds like, and sometimes the me too, like, oh, I have felt like that before, like empathizing with people. And this is what helped me. I felt nervous to, go on a patio. But once I did it, it actually felt really great for me. Like I felt proud of myself. Right.
Yeah, no, there's so much gold in there. I mean, on a personal level, once I'll say, I'm going to regret saying this, but like just to show that, I'm very human. My kryptonite is like mice. If you show me any rodent, I will like legit jump on this table. Like I'm like, I can't do it.
Yeah.
And that whole principle of exposure and doing stuff that you're, normally anxious about is gold. Because, this is how you build that character. That's how you become, for our kids, those formative years, this is how they become who they become.
More resilient.
More resilient, absolutely.
You can have fears. There's a wonderful Nelson Mandela quote where he says, courage is not the absence of fear. It's feeling afraid. I mean, it might not say it quite this way, but it's like feeling afraid and doing it anyways.
Yes, right? Absolutely. Like, I think it's one of the lessons I try and put on the kids is like let's do stuff regularly that we're kind of anxious or scared about. Because once you know what I mean? Because like a lot of times you do it and you're like, wow, I actually can do it. Applying for a position, starting a podcast, starting a clinic, all these things, there's a lot of anxiety around it. But once you start, and as you said, it doesn't have to take something big. And
that's the thing for kids right now, and why kids do need to be back to more experiences, more normal, so we don't end up with a generation of super anxious people, is that all kinds of experiences overlap. So I'm sure you have examples from your kids this summer. I know one of them went off to sleepaway camp. I remember 2 summers ago, their camp didn't unfortunately pull it off this summer because of all the late notice. But 2 summers ago, for the first time, all 4 of my kids went to camp. The 2 younger ones were just there for like a half week. And to see that, of course it was scary, but the boost in confidence, because what happens is when we avoid, we're sending ourselves a message, I can't. But when we get anxious and we do it, and then we use our coping strategies, there's this message, I can, right? So actually on the weekend, we went to a water park for the first time in a long time with my with 3 of them, not the teenager. And it was so amazing. My youngest daughter actually had a lot of like anxieties, as she was growing up, like just like animals and, heights. And for her to see what she could do that she couldn't do 2 years ago, like bigger slides, one of the slides where you're going through the dark, she's so excited and proud of herself. And that will translate into tackling things that make her anxious at school, right?
No, I love that. I like the same thing with one of our kids too, going to camp here, and just first day was just horrible. And, because it's been so long since they've had to, hang out with new kids and so forth. And then, back at it, meeting other kids the next day. And before you know it, he's back to himself. So
yeah. Amazing. It's so, so important. So if we think about what many adults are dealing with these days, they might not feel very good about being anxious. Like it's easy for people to get kind of anxious about getting anxious, which again leads to more avoidance, or to feel silly about it, or maybe to want to embrace a set of beliefs that supports it. Like that's a real worry about if we are going to need, which, you as the physician would know more about, but like if we are going to be moving to this is endemic, COVID will be around, but because of vaccination, the risk profile is much lower. Well, what we don't want is for people to cling to this belief that they have to stay home because that's what they were told for so long and miss out on life experiences.
Yeah. And that's what my exact fear too, Michelle, for a lot of the people is you see how much they're suffering and how much they're missing out on. not only our youth, but just everyone, and like from the day to day. And I read, it was one of those gym tweets again when they said they were going to open up gyms. Someone said, I've been self-quarantining for 537 days. And I'm like, my God, like that, like to think that this is what you felt like you had to do.
Yeah.
I remember even I'm hearing this from another podcast. I can't remember which one. So I apologize for the plagiarism or whatever the term is. But there was an oncology patient that, in the UK, that he was was so fearful of having COVID that getting COVID, that his oncologist actually said, you know what, you're going to come out with a walk with me or a hike or something, play golf, something along those lines. And that first step for that oncology patient, like realizing, wow, this, like, I can be smart about this. I can live. I don't have to stay physically in my house the whole time. I can be a human.
Yes.
Connect in a safe way, was just so enlightening and changed the trajectory of his journey. And I just want that for people. I just really want that for people.
It's so concerning. And like, there are parents who, beyond being afraid to send their children to school because of what I've started to call the anti-school group out there, like there actually seem to be a set of professionals that are anti-school. But unfortunately, as I know you have said, like, much of it is not data driven. Those of us who have had our kids in school, my kids were at 3 different schools. I think each of them later in the year, each had 1 case, no spread. So we had evidence that schools were safe for our kids. But if you don't send your kid to school and you believe certain headlines or narrative that this airborne virus is dangerous for children, and you don't have a chance to gather evidence otherwise, and then you don't send them out to play. Some people are scared to let their kids play in their own backyard. Yeah. Even during periods like during the 3rd wave, afraid to open windows. Yeah. So talk about a public health disaster. Right? Like you could have children ending up with scurvy, let alone, there have been reports of more type 2 diabetes, fatty liver disease, things that we don't see in many children normally, right? Yeah, I don't know what happened, but we just, in my opinion, swung the pendulum too far with the fear messaging. I know why the fear messaging was there initially, to get some buy-in, but man, this deep in the pandemic, like, I still have, like, if I were to ask you, Michelle, how many patients that I've seen in the year and almost a year and a half of the pandemic that have contracted COVID outdoors, how many do you think say if I saw 100 patients, how many do you think we clearly? Well, I'm sure many people would say more, but my guess, because I read the research and because I would say probably 0, although I know you never know for sure, or 1 or 2. Like 0. In terms of a clear outdoor exposure, the ones that you might hear about, they often are in the car together or whatever. Yes. And to that point is that, there's still people that are extremely fearful, even being at a distance, that they're going to get COVID this way. And, I even had a buddy that his kid went to the park. This is in the midst of the 3rd wave, or beginning of the 3rd wave. And, Delta, UK variant was a fear. And he was like, buddy, my kid, 5-year-old went to the park without a mask. I forgot to bring one. Like, should I be scared or what have you? And I'm like, buddy, man, it's okay. Like it really is. Look really at all the space. Look at all the fresh air, right? But to think that they had that huge level of anxiety and fear when, that threat was really negligible, it's just hard for, to hear people having to go through that. And as, you'll know better than this, it's just some of these impacts can be pretty chronic. You know what I mean? For sure. I'm really worried about the long-term effects. So for people, whether it's health anxiety or social anxiety or just generalized anxiety, just to start small, right? This idea that if you expose yourself to something you haven't done, like you were giving sometimes it helps to say, look at a concrete example. So if it's about mice, your Achilles heel, So it might be that in therapy, what would say is like, look at some photos of mice, then a video. That's too much, hey, Kwadwo?
Oh my God. Yeah, I mean, yeah, we could do this.
It's so funny.
Oh my
But yeah,
God.
like eventually you'd build up to, you might even have someone who really wants to overcome this fear that would, I don't know, go somewhere where they could actually, you know, look at a mouse in an aquarium or something. But yeah, you're not there yet. It's okay. That's why we do gradual exposure.
Those
thinking about mice. But when you expose yourself, so let's think now about a social situation and like the ladder, like the hierarchy. So say the first step for someone is going on a socially distanced walk with a friend they haven't seen for a while. Well, what you'd want to work through is how can you balance your thoughts, reminding yourself of the evidence of the coping strategies in place. I'll be vulnerable with my friend and tell her this is a big step, so she's okay walking on the other side of the sidewalk, or we'll go on a path where we know we don't have to be too close together. Maybe the first time I wear a mask, and then I aim to do a second walk without a mask. So it's this idea of really gradual exposure. But I do find for people who are really anxious, it's best if it goes hand in hand with a bit of vulnerability, like open up to people and let them know you're struggling so they can respond with empathy. Obviously, if someone can't respond with empathy, they're not a good person to start out with. Mm-hmm. Rather than if you try and hide that you're anxious, you might get defensive, or you might, you know, tell someone else they're crazy for taking off their mask rather than like letting them know how you're feeling.
I really like that. I've seen this a couple of times in the hospital where people, like, I got to tell you, what no matter what wave, when some of the public comes into the hospital, they are super scared. You know, a lot of people haven't left their house in a while, and that vulnerability, you could see how much it helps. Like, I saw a situation where, you know, this poor old lady was like shaking in fear, and she needed direction. And the lovely healthcare provider, she was like, you know, I could see that you're anxious about it. I'm vaccinated. I could show you from a distance or whatever. And it was a beautiful interaction because, you know, that visitor felt seen and felt, you know, that level of safety because, you know, opened up about her vulnerability about, you know, COVID and being fearful of it. And that healthcare provider was able to now address it appropriately, like address it with compassion. And I just remember thinking
I've had a few clients who have had to have contact with the medical care system who haven't been out that much, like who work from home. And you're so right. Like for them to not start off like having a walk with a friend or at a patio, but having to go to a merge or something like that. If, you know, maybe it's with their child or for themselves, but that's 100% true. Like something for them to feel proud of is, I was honest right off the bat and said, this is really huge for me. I'm really scared. And it's very hard when someone's saying that to be impatient or, you know, so they're more likely to get a supportive response. But say they tried to hide it and they looked like that difficult patient who maybe wasn't being a good historian or telling their story well or explaining, but the healthcare professional doesn't realize that's because like they're having a panic attack, right?
Mm-hmm. Yeah, it's so true. Like it does look so different when there isn't that level of vulnerability and openness. It's just like, who is this curmudgeon person? Why are they being short with me? And this is the lessons I learned from you guys, actually, from, you know, my wife and yourself is like, you know, what's the root of this? Like, you know, usually people aren't that. Like anxiety is like a secondary emotion or something. Is that what it is?
Well, anger is always masking other things. Yeah. Hurt, disappointment, fear. Like anger never exists by itself. And oh boy, there's so much anger right now, right? In society.
My goodness. Yeah. I actually find one of the challenges too, and I'm not sure what the best approach is. You know, a lot of my personal behavior is because I feel like some other people might be anxious. Like, so like if I'm walking if I'm walking on a sidewalk, for example, I might like walk on the street a little bit to kind of appease, you know, there's that level of anxiety of like, oh, you know, he's walking too close. I don't want to, you know. And like, it's a read. Like sometimes you could see they might start to put something around their mouth, or they might put their mask up, or they're walking with the mask. But at the same time, I'm just like, want to show like, hey, this is okay. We can live a relatively normal life and still be protected, especially if you're vaccinated. But yeah, I'm always torn on terms of how I should be carrying myself.
Well, I think I do appreciate what you said there. I do that too, where even though I'm not worried about passing right by someone, sometimes giving a bit of space so that people feel comfortable. But I think when we like pair it with a smile or an acknowledgement, a hello, it really goes a long ways. And especially outdoors where there is less masking and people can see each other's faces. Mm-hmm. Like, again, when we look at trauma and all the disconnection, so anxiety is one of the symptoms of trauma, and all this not seeing each other. I mean, I know I've heard healthcare reflect, and we know there are people retiring, quitting healthcare. I mean, it was in the headlines the other week that Quebec, they're having a big problem, I think, keeping all the, everything open. And I know from working with a lot of healthcare, like clients in my practice, that it's not usually the fear of COVID at this point. Of course, in the initial outbreak, yes. It's the dehumanizing of healthcare. It's not seeing colleagues' faces as much. Mm-hmm. It's misreading what's happening with a patient because you can't see their face, or they can't see you smile, or they don't have a family member with them. Like, so again, when we look at anxiety and trauma, like out and about, if we can smile and say hi to people, just show them the good in humanity, like we can all make a difference. I was in the grocery store the other day and, wearing my mask like everyone else. But this older gentleman saw me, like I was kind of flying through the grocery store. I was grabbing some quick, like one of my kids was having a few friends over to the backyard. So I was going to get easy lunch food. And it was really funny because my husband always jokes about how fast I do groceries. Like I'm a fast shopper. I'm not price shopping. I'm like, time is money. I'm getting through the grocery store. I'm getting home. But this older man said exactly that. He goes, wow, you're a fast shopper. And I was like, wow, no one starts conversations anymore out in public. So, you try and smile behind your mask. And I always think I started my career actually after grad school at an EAP where we did telephone counseling. And I used to train other counselors and say, like, put a smile into your voice. That's possible, right? Yeah. So with him, I was like, I really tried to respond warmly. And we had this nice exchange and off I went. And I thought, yeah, like people really need more of that, the connection.
Yeah. I mean, this is one of the things that, I started a new leadership position, and it's one of my missions is to really have that kind of supportive, positive outlook with our staff, like enough with the, we'll be empathetic to the struggles, obviously, but we want to also have that, that positive mindset, that good attitude, the supportive attitude with each other, because it's medicine right now. It's medicine. People, I've seen it directly when especially leaders are coming down on their staff. Why aren't you doing this? Why aren't you doing that? Once again, ramping up burnout, ramping up anxiety. You'd see it directly. And right now, in my opinion, it's time to really, give the medicine, which is that positive attitude, that positive messaging, and that support.
Well, and if people who are practicing medicine and part of the healthcare system get it from coworkers, family, people around them, they're more likely to have some to give their patients. And you're right, it is medicine, right? Mm-hmm. If a doctor is empathic with a patient, I remember long ago reading research where a doctor listens well to their patient, patients are more likely to follow their advice.
100%.
Right?
100%.
If someone is hesitant about vaccination and they're shown empathy and concern, maybe they have medical trauma and their doctor acknowledges that. Yeah, I can see at times you've been let down. It's hard for you to trust. They're more likely to end up following their doctor's advice, right? When people are shamed and blamed, I mean, I think with, some very ambitious goals we have about reaching more people with vaccination, although we're already in a pretty good place, Personally, as a psychologist, I think that's the big barrier. Now we've got a society where you've got a huge number of people who are like, yes, vaccine passport. These people have to be forced. What better way to create resistance, like to not trust and to think, why are they forcing me? It's really a shame.
No, and I read this somewhere. I can't remember what book it was in, but motivational interviewing?
Motivational interviewing.
Yeah.
Woolnick, Butler, Miller, they're the group that developed it. Yeah.
I'll let you. Yeah, that's your huckleberry for real. But they were using that for childhood vaccinations as a way of really ramping it up. And I believe it was in Quebec, at least the story that I was reading. But it came down to exactly as you said, the opposite of shaming and blaming.
Yeah, their principles are like roll with resistance, resist your writing reflex, which makes healthcare too prescriptive and directive. Like ask questions, do more listening. Yeah, if there's resistance, don't fight it, roll with it, try and understand it.
Yeah, it's going to be my mission after this is done to find they started this program in Quebec because of like the motivational interview, how successful it was. So, I'll find this for the people.
Yeah, it comes from addictions work. Many of the hardest to help patients. And it's excellent. I have a little book called Motivational Interviewing in Healthcare.
Yeah.
And
No, I think we could, that sounds like number one, a show. And number two, something that maybe everybody all the young upstarts need to read about, because that's so important, especially now. Yeah. Michelle, anything we forgot to mention in terms of social anxiety? I just want to make sure that we crossed all our T's.
Yeah, I think so. Those two main principles to start. Avoidance is a natural instinct. Try to approach, like I always say, approach rather than avoid. Even if you approach 5%, and while you use your coping skills, you're approaching, and you don't have to go the whole 9 miles. Like if someone, say their goal is to go on a patio with their partner, if they go on the patio for 20 minutes and they're like, that's enough for me, but I brought my anxiety down while I was here, I'm feeling better, well, then it's a success. If you get to the patio and you leave because you're anxious before sitting down, you might be sending yourself a message that you can't do it. Try again. So approaching rather than avoiding and increasing your exposure gradually. And then I think just kind of the conversation we could just went into a little bit about kind of the state of the world is just for people to acknowledge that anxiety does come from trauma. It's not just capital T trauma, like you're a nurse or physician or respiratory therapist working in ICU. Like everyone has had trauma. Many people have previous traumas in their life that have affected how they perceive COVID, whether they're the people who hate restrictions or embrace them. Like our own life stories are part of that. But there's a wonderful book called Trauma and Recovery. It's a really old book now by Judith Herman, and a medical doctor. And she talks about the stages of recovery from trauma. So she looks at like people coming back from war, like all kinds of trauma. And it really struck me. I might have talked about this before on the podcast, but I was rereading it at the beginning of COVID, and I had read it like early in my career. And she talks about the stages, and I actually wrote them down so I could go through them, because I think I actually did a presentation for healthcare and wellness professionals early in the pandemic, and they all really related to it, because we would have never known back then how long this would be going on. But she talks about the stages. So first is you have to establish safety. Finding people you trust. Maybe that's a therapist. Maybe it's, reconnecting with a few friends. So establishing safety by finding people you can trust. Then remembrance and mourning. Everyone needs to tell their story. That's very therapeutic. Again, it might happen in your life. Maybe it happens professionally. So it's kind of mourning what's happened. Like that helps us actually empower ourselves to move forward. And then the third stage is reconnection with the world. With the normal world is what she talked about, but we know there's a new normal. The world's not going to completely go back to how it was. So even if the world is changed, we need to reconnect with it. And then the fourth stage is commonality. So what do we have in common with others? And I think this ties perfectly to what we were just talking about. All this division, all this anger, it really leads us away from recovery. But if people who have been in different spots with COVID look more for what they have in common with others, that's actually a big part of recovery.
I like that. And there's probably more in common than we all think, especially.
Yeah, we all just want to be okay, right?
Yeah.
Like everyone wants that same thing.
Yeah. Yeah. It goes back to, what's our underlying values, I think that's an important message, because if we stick with that, you'll find way more commonality than you ever think you will. We just want, what's best for all of us.
Well, and so here again, it's this theme of contribution. How can everyone contribute to the good in the world instead of all the anger and the division? And I think that was a theme I liked your recent podcast with Dr. Prasad, right?
Oh, I was just about to bust it. And that hasn't left me, by the way. That whole, so for those that missed that one, Vinay Prasad, a couple of weeks ago, this guy's a brilliant voice when it comes to COVID, hemoncologist. And I can't, it hasn't left me, this idea that, this was a time where a lot of us would have felt that need to serve, to that duty. What can we contribute right now to deal with this worldwide pandemic, this crisis? And I don't know. It just left me, because this was I guess personally, this was a huge motivator. Yeah. Not only doing what you're doing on the front lines, that was, if anything, that's easy. That's my job. But the messaging, the podcast, this real mainstream media, the bridges over barriers, the charitable stuff. This is the time to all step up. Yeah. And I don't know if this is appropriate to say, but I'm overall disappointed in that lack of duty, in that lack of
that's right.
People wanting to step up. It's shocking, actually.
Yeah.
When you take a bird's eye, like a bird's eye view, and just say, like, how many people were willing to just stay home and judge. Like, I'll give you an example. This is another one that haven't left me. I was out golfing with somebody, and they said a few things. How could these hotspots, we're talking about strategies in Ontario, which we thought could have done better. It was like, how can these hotspot areas where they were being bad and not listening to public health, and they get vaccine before I do? And I'm like, trying to be, compassionate. But at the same time, I'm like, what though? Have you not read a single thing out there, man? Like, these people, if they could stay home, they would stay home. They can't stay home. Yeah. This is the problem. Oh, and then it was like, oh, this is only a few people. I'm like, listen, this is what we were seeing. You weren't people that had the choice of staying home and under Zoom and doing their job from afar. These are people that had to be at work and serve you. Your Uber Eats, your your loved one, your Amazon factory, all this stuff that you got to just thrive and enjoy. They were stepping up, doing their part. So don't be judging these guys for getting sick. And yes, they do deserve to have their vaccine early.
This is driven by the government and media narrative. Let's call a spade a spade.
Yeah.
So people have been conditioned into thinking this way. And it feels like everyone likes to judge, right? We have this society where we like to feel better. And there's this new kind of like religion of public health that some people have been able to follow because they do have the privilege of working from home. And yeah, I totally understand what you're saying, Kwadwo, because personally as a psychologist, I've also found just that way of thinking like really, really hard to hear sometimes. There was a great cartoon the other day. I actually took a screenshot of it, so I'll send it to you in case you didn't see it. And I don't know what publication it was in, but it was of a guy sitting in the backyard of his house. Did you see it? Yeah. And pointing a finger like you're the problem. And it's like these people in their crowded little, high-rise apartment windows.
Yeah, no, it's, as you said, data-driven, follow what the data showed. Let's not get too political. But yeah, that sense of duty, which is what I was a bit, I don't know. It makes me sad to think that, this wasn't more of a global, maybe I'm being too harsh. Maybe it was a lot of people feeling that, but there was also a sense that people didn't feel that sense of duty, and I mean,
very worrisome for sure, because part of our recovery does need to be contribution and duty and helping others. I remember we talked about that too with like the 4 C's of coping during your 4-week challenge in the winter. Contribution, connection. And so there were all these lost opportunities, right? Like maybe in the beginning, not possible, but like it's such a shame that basically anyone who did volunteer work had to stop doing volunteer work. Yeah. There's no one to help the kids in school who have trouble reading learn to read. There's so few, no one's going into the senior homes and, putting a smile on their face, being like a healthy, well, maybe that's starting again. So I hope we can get back to that, Yeah,
I hope so too. And, I do think we're, overall, I know the term is used commonly, humans, we are resilient. We're going to rally. I'm hoping we'll rally behind this whole, this extremely effective vaccine campaign. I think we just really should push towards getting back to normal, and we'll get there. We'll absolutely get there.
Absolutely. But in the meantime, people who are having a hard time, just remembering that helplessness, not contributing, not feeling in control, helplessness and disempowerment are these core experiences of trauma that get in the way of moving forward. So if people out there are listening and they have been feeling really socially anxious, and maybe they're introverted and they never want to go back to as much, as many parties or things they didn't enjoy before, that's okay. We're not talking about everyone having the same level of social engagement, but choose for you what's a logical next step, to work. And of course, if you're having trouble, reach out for help, the help is there. And
Absolutely. Resiliency Clinic, you know what I'm saying?
And actually for people who are having trouble financially, which unfortunately includes many people in healthcare, many of the plans are insufficient for hospital employees to do. We actually have a couple of master's level interns right now who are doing sliding scale. So if anyone reaches out through my website, resiliencyclinic.com, and says, I'm in healthcare or I don't have insurance, I will, at least for the rest of this calendar year, I can help them get really affordable therapy.
I love it. Thank you.
Connect is another good way for people to get 1 to 3 free sessions.
Which one you said?
It's counselingconnect.org.
Okay.
We're actually taking some of those referrals through my intern program, for pro bono counseling. It's through Centertown, I think, a community agency. So that's another good resource for people. But sometimes even just a few counseling sessions where you can be open, tell the real story maybe in a different way than your personal life. You can make a plan and get started.
Listen, if there's anyone doing that sense of duty right now, it's Michelle Sorensen. Thank you so much. All things Michelle, Resiliency Clinic, you heard it. Thank you for those that are listening. Thank you for listening to the podcast. You can find us on solvinghealthcare.ca. We got Solving Wellness, healthcare providers, as you know, trying to reduce our sense of burnout. So this is one of our initiatives. We also got online workouts, yoga sessions, cooking classes, nutrition tips, just really creating that sense of community, trying to change that boogie. Follow us on Instagram, YouTube, Facebook at Quadcast, and leave any comments at quadcast99@gmail.com. Thank you, everybody. Stay safe, stay wonderful, be joyous.